Welcome to Horizons of Thought. 2 days ago, David Nabarro of the World Health Organization dropped a bombshell on the world by saying that not only he, but the World Health Organization would like to state very clearly that lockdowns should never be the first line of defense against COVID-19 or really any pandemic. Today, I'm going to drill down into why it is that the World Health Organization would say such a thing, even though many people have gone through weeks and months of lockdowns, and how it is that you can analyze and understand the purpose of saying something so shocking at this time. On the surface analysis, you might think, oh, is COVID-19 less deadly than we thought it was? And you'd be right. If you take a look at research into what's called seroprevalence, which is a way of testing how often or how many people in a population have actually been infected with a disease, not just people who currently have it active, which is the normal way that they test for COVID-19, but testing for antibodies, a little more complicated, a little more expensive, and a little more risky because sometimes you'll get false positives and negatives. But you can basically figure out what percentage of a population actually had a disease rather than just the percentage of the population that your official records have told you. And we now know from the World Health Organization and from a multitude of other publications that about 20 times more people on planet Earth have had COVID-19 than was previously thought. So if you look on the news and you see that they say that about 35 million people have had COVID-19, the data strongly suggests, with a wide margin of error, you should know, about 780 million people have actually had COVID-19. That is hugely different, but the death rate remains the same. So what this basically tells you is that COVID-19 is likely far less deadly than any of us had thought, but at the same time, you can still overwhelm medical systems because it spreads far more quickly. And so you can get concentrations of people who are really sick. And so it would be reasonable to listen to David Nabarro's conversation about why lockdowns aren't necessarily a good idea in the face of a simple argument that perhaps COVID-19 isn't as dangerous as we thought it was. But that would only be a first pass analysis of what David Nabarro is saying. Because what he really suggests in the video, which I will link to at the bottom of my video, is that you should not be using lockdowns as a first line of defense against any pandemic. It's not the first response you want to have in a pandemic situation. So why would you not want to use this as a first line of defense when a pandemic can be actually really even more serious than this one? Consider something like the Black Plague, which killed, I think a third of Europe at the time. It was incredible. If you look at diseases like that, you might think lockdown is, of course, the first line of defense you should have. But what you might think in this case is, okay, well, if he's saying this for all pandemics, maybe he's worried about something else that matters more. And so there is, in fact, another pandemic in the world that's going on that at the moment does matter as much or more than COVID-19. And that is the ongoing hunger pandemic. The World Bank, World Health Organization, United Nations, and many other organizations believe that due to lockdowns and due to the way that the world handled the COVID-19 pandemic, we have doubled world poverty. Doubling world poverty presumably means doubling extreme world poverty as well. And the doubling of extreme world poverty in this world would mean that 7.2 million children are going to die of malnutrition and hunger this year that would not have otherwise died this year. That's how incredibly serious it is. And I'm basing that off of a real simple analysis. If last year we had 20,000 children a day die in the world because of malnutrition and hunger, and you double that rate, you get to 40,000 children a day, and that gets you 7.2 million children next year. It's shocking and devastating. And you can imagine in the face of COVID-19, which has killed about 1 million people now and might kill another 3 or 4 million people, that number is considerably smaller than the 7.2 million extra children that are going to die because of hunger and malnutrition. as a result of the various lockdowns we've done and the various constraints on supply chains and economic behavior. But I'm going to give you an even deeper analysis that I think you want to take from the words of David Nabarro if you go and listen to them. And that is that lockdowns are reasonable for a short period of time if that is the only avenue that you have to deal with a pandemic. I'll give an example in New Zealand. When COVID-19 information came to the New Zealand government, one of the first things they realized is that it didn't need to be a particularly dangerous pandemic. It didn't need to cause a lot of risk. We already didn't have a healthcare system that was capable of dealing with this. This country loses 1,500 people to the flu each year, and a considerable number of those people probably die in the wintertime because it's actually kind of difficult to get hospital spaces in this country in the winter because we're overloaded by our flu and cold and other disease cases. In short, this country doesn't really have enough medical care to even handle an ordinary winter. And so when Jacinda Ardern and Ashley Bloomfield and the rest of them were taking a look at what they were going to have to do, they realized that they could not tolerate a situation in which this disease was allowed into the country under the current medical regime. So they were going to have to lock the country down to prevent an unbelievable disaster from happening, which we did not have the capacity to deal with at all. That's fine. You use a lockdown on that purpose to then go fix the medical system, to increase the number of beds, to make sure that there is a better way of dealing with future illnesses, so that if you need to reduce the lockdown and you can then just go from having no curve to flattening the curve, you can allow something like COVID-19 to come in, and you have a way of dealing with the cases as they come in. At the same time, you might also just do what another thing that's been done in this country, which is to improve your tracing, so that if somebody gets sick with the disease, you know more quickly. You can find all the people they contacted, you can put them in quarantine really quick, and you can deal with it on a piece-by-piece basis, according to the people who've been tracked. This is really what David Nabarro is getting at, that you want to come up with a solution, whether it's increasing your beds, whether it's increasing your contact tracing, whether it is a whole combination of things, maybe increasing the amount of face masks, social distancing, you name it. You put all of these things together as your plan to deal with the pandemic, because you cannot rely on lockdowns as your main solution to a problem, when using lockdowns will destroy economies and cause really poor people to suffer and die as a result. That deeper still analysis, that you would want to have multiple layers to your plan to actually deal with a pandemic with an immediate short-term measure and then more long-term measures that can allow you to cope with it over time, culminating, of course, in the quest for the vaccine that's going on right now. And it is actually going really well. I think there's 5 or 6 third stage cases right now on finding a vaccine for COVID-19. So the long-term plan is going really well. But anyways, my point is, when you think of a statement like what David Nabarro is saying, what he's really suggesting is that wise governments and wise institutions have multiple plans and look at all the ways that things can go wrong with a policy that they enact. And they don't enact a policy that's got obvious blunt force problems with it, like a lockdown, without having plans to use something else as the primary method of dealing with a pandemic as quickly as humanly possible, by mustering all the rest of your capital and all the rest of your intelligence and all the rest of your people to improve other situations on the ground. That is fundamentally what the World Health Organization is now suggesting that people do. This has been Horizons of Thought. I hope you enjoyed this episode. If you have any questions, put them in the comments below. If you liked it, click like. If you disliked it, click dislike. If you want to support this program, go down below to the support link and go to DonorBox and contribute monthly to this program. I hope to see you again a lot sooner than I did for this last video, between the last video and this one. Thank you, and have a great day.